Today I will be discussing diabetes. Firstly, what is diabetes? It is described as a chronic metabolic disease that encompasses a state of hyperglycemia and disturbances of carbohydrate, fat, and protein metabolism. These occur as a result of either defects in insulin secretion or insulin action or both. The complications of diabetes can be broken down into microvascular or small blood vessel, which is retinopathy, nephropathy, and neuropathy, eye, kidney, and nerve, and macrovascular or large blood vessel disease. Today, I will be concentrating on the macrovascular complications. Firstly, let's get the current statistics out of the way. According to the International Diabetic Federation in 2015, deaths from diabetes-related complications account for 5 million per year. A staggering amount, seen as it is more than TB and HIV combined. Currently, we have 1 in 11 people worldwide with diabetes, and by 2025, it will be an astonishing 1 in 10. Macrovascular complications of diabetes accounts for approximately 30% of diabetes complications, depending on the locality. However, although less than the microvascular complications, these cause a higher death rate than do the microvascular complications. So where do they fit in? They represent 3 main aspects of abnormalities, namely cardiac, strokes, and peripheral arterial disease. The following slides showcase the leading culprit that is responsible for the downward spiral. In diabetes, there is a hyperpermeable state in the intimal layer of the blood vessel. Over time, combined with other comorbidities like hypertension, the lipids are forced into the inner layers. This decreases the lumen size. It is further complicated by clot formation, and combined with other risks like smoking, they lead to further damage to the lumen and thus reduce blood flow through the blood vessel. Here are some of the risks that contribute to developing vascular changes to the large blood vessels: smoking, poor sugar control, hypertension, dyslipidemia, sedentary lifestyles, and poor diet. To understand how these occur, here is a typical diabetic patient: overweight with bad eating habits and lack of exercise. This boils down to a metabolic derangement consisting of increased waist circumference, which is important, by the way, as some people may be looking average weight but have a bigger waistline, which puts them at higher risk for cardiovascular disease, as much as a 2 to 4-fold increase. Uncontrolled lipids. A disproportionate ratio between the good cholesterol and the bad cholesterols. Then comes hypertension, which becomes uncontrolled, together with poor glycemic or poor sugar control. Of note is that when a diabetic smokes, he is at high risk for heart disease, more so than the general population. So, how do we identify which are the larger vessel target organs? Broken down into cardiovascular conditions, we find ischemic heart disease leading to acute coronary syndromes, unstable angina, and cardiac failure, which are the leading causes of death in a diabetic. With strokes, here the brain is affected, and apart from being a fatal occurrence, may also be debilitating to live with, especially when left in a cabbage state. The first stroke puts you one step closer to the next, if not adequately controlled. Peripheral arterial disease or peripheral vascular disease. With hardening of the arteries as well, peripheral vascular disease is the leading cause of lower limb amputations. Besides the amputations, it may lead to chronic foot infections, foot ulcers, and a general poor quality of life. The psychological aspect here, together with strokes, is of the utmost importance. The diabetic with these complications can lead a very lonely life despite having the help of people around them, as they have lost their individual functionality. So, in order to diagnose these conditions, we undertake some routine and sometimes more in-depth investigations to establish ways to diagnose, fix the risks, and treat the complication. Blood tests like blood glucose levels, consisting of fasting state level, random levels, and 3 monthly averages called HbA1c. Lipogram, which is a full cholesterol testing, image testing like plain x-rays for peripheral vascular disease in a condition called Charcot's arthropathy, which your doctor will talk to you about if he suspects it, and other more expensive tests like a CT or MRI scans of the brain when suspecting a stroke. Other non-invasive tests like electrocardiograms, echocardiograms, Doppler ultrasounds, together with other clinical bedside tests to further evaluate the respective complications. Treatment includes controlling risk factors like smoking, changing your diet, or as I like to call it, fine-tuning or tweaking of your diet. Introduce exercise as the World Health Organization suggests, losing between 5 to 10% of your body weight as a starting point. Regular visits to your GP to assess and introduce you to a multidisciplinary team, like the dietitian, the nursing educator, the cardiologist, the eye specialist, the bone specialist, the podiatrist, a psychologist, and of course the specialist endocrinologist, amongst others. The backbone of every treatment is to develop a strong conviction to make sure you don't end up with these conditions. When you are diagnosed with any of these 3 macrovascular conditions, you can have the utmost confidence that the healthcare team will be well equipped to manage them. But your role is to become the center of your diabetes management team. Educate yourself at every opportunity, empower yourself, and remember that even some doctors share this condition with you. Diabetes can affect anyone, and a healthier you is the key. And the cliche, prevention is better than cure, has never made more sense than before when it comes to the macrovascular complications of diabetes. Resistance is never futile. I hope you found this informative, and discussing this topic with your doctor, even if you didn't understand me, trust me, repetitive listening increases your knowledge. So feel free to discuss this topic with your friendly healthcare provider. Thank you.